All right, we are here today with Kima Toze, and this is a beautiful webinar um, around the subject of stillbirth certificates. And so I will just introduce myself really briefly. I'm Jennifer Caton with Return to Zero. I do a lot supporting all the support groups, leading those, and helping lead some webinars. And I too am a baby loss mom, and my son James was stillborn in 2010. And soon after, I don't know where I heard it from. I wish I could remember, but somebody mentioned there was the ability to get a stillbirth certificate. So to kind of, instead of a death certificate, I mean, of course, we got a death certificate, but to be able to get a stillbirth certificate, which is like getting a birth certificate for your child. It's recognizing that they lived, that they existed. And that was really meaningful for us as a family to be able to get that. So I want to quickly introduce the topic, and then I'll turn it over to Kima for the presentation. So today we're going to talk about more than a piece of paper. It's a birthright, easing the emotional pain of stillbirth through advocacy and policy. So this presentation will cover the rate and impact of stillbirth in the United States, legislative efforts to elevate awareness around stillbirths, and offer support for individuals and their families. And special focus is given to the certificate of birth resulting in stillbirth, which may provide emotional comfort, and how it is obtainable in many states, and how people can be active in advocacy and policy changes around these issues, which is very much needed right now. And after attending this webinar, you'll really learn the history of stillbirth in the US and the present day matters affecting maternal health. You'll also will investigate the social, emotional, spiritual, and economic consequences of stillbirth. After this presentation, we'll have an understanding of the different states that offer certificates of birth resulting in stillbirth. And examine the importance of advocacy, policy awareness around stillbirth, and the impact and challenges of families touched by this loss. So we'll also identify 3 specific ways to advocate for change at the policy level in your local area and beyond. Well, Kima, I am so excited that you're here doing this with us. It's such a privilege to have you. And I want to say to those coming in, please feel free to, in the chat, let us know who you are, maybe your name and location, and let us know if you're a parent or provider today, or even both. All right, I turn it over to you. Thank you so much, Kima.
Thank you so much, Jennifer. I just want to start by saying thank you to all of you who are here on a Saturday, nonetheless, to join me to talk about such an important and very sensitive discussion. I also want to say special thanks to my friends at RTZ Hope for providing me with this platform to speak with you all today. And I really hope that this presentation is enlightening, comforting, and also inspiring. So just a little bit about myself. I'm a survivor, thriver, a servant leader, a tree hugger, and a goat wrangler. But outside of that, my professional background is as a clinical social worker. And currently I sit on my state's maternal mortality review panel. Also a patient council member for the Preeclampsia Foundation. And through those avenues, I take opportunities such as this one to raise awareness about perinatal loss, also about Black maternal health in the crisis around health equity, and to really help impact and raise awareness to the challenges faced by many women in our country. So specifically about this presentation, in 2020, I joined a group of bereaved parents in my state, bereaved moms. I live in the state of Washington, to help push legislation to pass the certificate of birth resulting in stillbirth in the state of Washington. And so this certificate recognizes the birth of stillborn babies, and it also helps ease the pain of such a tragic experience for many birthing families by raising awareness and also recognizing that our babies did matter and they did exist. So let's talk about like kind of what we're going to cover. Jennifer did a great job of sharing that already. Here's just some poignant things that we'll cover. It's just, going through the history of stillbirth and some of the trends in our state, and excuse me, in the United States. Also, just exploring the significance of stillbirth and how it impacts families. Some providers or folks attending today may not have awareness of that, and others I might be speaking to the choir. And then also, I want to sort of talk about advocacy at many levels, but specifically about the importance of policy advocacy and how we as advocates can really take care of ourselves as well when doing this hard work. So, it's a sad fact that 1 in 4 women will experience either the loss of a pregnancy or the death of their infant. Unfortunately, many women and society as a whole are really hesitant to talk about this issue. And that's why each October, which is coming up pretty quickly here, is a time where we recognize and build awareness around perinatal loss and stillbirth to honor those suffering in silence. This is a quote from David Kessler. He's one of my favorite grief researchers. He lost a son. And so I like to quote him in a lot of ways. So he eloquently puts it here that grief must be witnessed because when it's witnessed, something profound happens. And what we all want that profoundness to be is change. And so let's look at stillbirth from a more global perspective so we have an understanding of it. And then we'll take a closer look at the United States. So this chart is from the CDC, and it reflects rates of stillbirths in the United States from 1990 to 2020. And what we know is that in the United States, 1 out of every 140 births results in stillbirth. And this rate is slightly higher than the number of infant deaths occurring within 1 year of life, and 10 times more than the prevalence of sudden infant death syndrome. According to both current data as well as statistics from the past, stillbirth remains an issue with global reach. It's estimated that nearly 3 million infants are born stillborn annually, and a number exceeding the cases of death caused by HIV/AIDS. But nonetheless, stillbirth receives very little attention on a global level when it comes to this really important health topic. If we look at 2020 specifically, there were approximately 21,000 reported cases of stillbirth in America. And despite medical advances in our healthcare system, this figure in terms of stillbirth rates has stalled and over many years has really slowed down. But we also know that the rate of stillbirths, although they have declined in recent years, this doesn't seem to be the case for some ethnic and racial groups. Even with the reduction of 4% in stillbirth rates, Black women have the highest chance of stillbirth, which is twice as much as white women in the United States. Around 10 fetal deaths occur per 1,000 pregnancies at 20 weeks or later for this particular demographic group. We also know that American Indian and Native Hawaiian Pacific Islander women have shown higher rates than average of stillbirth. So if we really put this problem into context on a global level, of the millions of stillbirths that occur each year, 98% are in low and middle income countries, with 75% occurring in sub-Saharan Africa and South Asia. So stillbirth is not just a United States issue, it's a global issue, and it affects countries who have a lot of less resources. So medical professionals, they from what we know about stillbirth, suggests that chronic health problems such as diabetes and high blood pressure, which is known to affect African American women, are not the only reasons for these disparities when it comes to when we look at race and ethnicity. So we have a larger issue on our hands in terms of why are the rates different for certain groups. So by now, we're all familiar with the maternal healthcare crisis that disproportionately affects Black and Brown women, with higher rates of infant and maternal mortality as a result. There is some hope in that there's a movement that has sparked by these injustices, and it has captured national attention. It's captured attention of the Biden-Harris administration, which has recently developed what we call the White House Blueprint for Addressing Maternal Health Crisis. And in that blueprint, it contains 50 actions that over a dozen agencies, federal agencies, will undertake to improve maternal care. And this is for all women. But these issues are, while they're getting political attention, national attention that they deserve, stillbirth still remains an issue that is yet to find its place in our society's priority. And so it takes folks like myself, like Jennifer, like RTZ Hope to start to continue bringing the conversation to the forefront and mentioning it in our priorities. So understanding stillbirth as a tragic reality for many families, we know that we should increase awareness, right? And we should do that before loss happens. Many women and their families aren't prepared, though, for the possibility of stillbirth. And many providers are not having these conversations with families either. So some ways that we can shatter the silence of loss of stillbirth is really through recognition and through advocacy and being transparent. And, it's been said that when a child dies, the mother and the family's hopes and dreams die too. When a baby dies, the impact is felt throughout the entire family system. And that change can actually be something that is felt forever within that family system. And society has often failed to recognize this type of grief, leaving many families to feel isolated. In the past, when we look historically, miscarriage and stillbirths were hidden away. They were not talked about openly. So we have made some progress as a society where we can talk openly about stillbirth. But this, by and large, this type of loss is a disenfranchised type of grief. And that definitely compounds the loss for many families. And so this slide just represents some of the impacts of stillbirth on families. So leaving a legacy behind is something that families experiencing stillbirth think about. How will I leave a legacy behind? My child is no longer with us. Grieving the loss of a future or the dream of having that child in your family. Your family tree feels incomplete because a member of your family is not with you. And more discussions about how stillbirth impacts fathers, siblings, grandparents, extended family members needs to happen. These extended family members and how they experience stillbirth is still not fully understood. And so we need to raise awareness around that as well. So let's kind of just talk about some of the emotional and spiritual impacts of a stillbirth. As a culture, as a society, we don't really have language or traditions around the loss of a child. As a result, many bereaved parents who are religious or practice a faith, they may struggle to make meaning out of their loss. They may struggle to feel recognized in their communities because their loss is not considered significant or the same as other types of loss. And so they may question their faith altogether. Again, going back to the idea of feeling disenfranchised, feeling unseen in your loss. Parents of stillborns also report feeling pretty isolated, judged, and actively avoided in society in terms of the conversation around it. We don't really talk about it. And they're more likely than those who experience live births to suffer from depression and PTSD afterwards. The shame and blame associated with stillbirth is also largely unexplored. And there are some studies that indicate that bereaved parents commonly experience grief, guilt, shame, and self-blame as a result of their loss. And then when we talk about spiritual impacts associated with the loss of a pregnancy or a baby, again, we don't know how to commemorate this type of loss. So we might question, why me? Why is this happening? What's the purpose of life now? We may experience anger towards God or towards our higher power. And then we may hear platitudes from others, such as it was God's plan, or your baby's in a better place, that may have, good intentions, but the impact is, more damaging in a lot of ways emotionally. So another aspect of pregnancy, loss, and stillbirth is that we often don't address is the economic impacts to the birthing person and also to their family. What we know from research is that there are direct expenses related to stillbirth, and these expenses can range from $6,900 to $10,000 or more, in terms of how much money families have to pay when they've experienced a stillbirth. These costs can be associated with things like preparing to have the baby come home, so having a nursery. Parents may have prepared by having a baby shower, or maybe they've purchased items to prepare for that child to come home. Car seats, maybe they worked with a doula, and so they had to they didn't have insurance to pay for that type of service, so they had to pay for someone to help them during their pregnancy. We know that other hidden costs are not thought about either. Things like the complications during that birth that the parent may have experienced. Maybe there was an emergency C-section or other procedures that required the birthing person to stay in the hospital. And other costs are things like inadequate insurance coverage. And a big one is for families or for parents who need to return to work because they don't have enough. Their employer does not recognize that they've experienced a loss, and so they maybe don't have access to paternity or maternity leave. And so if they are recovering from stillbirth, they may have to return to work, and that can be emotionally draining and difficult for families. And so the financial aspects of that is, do they take maternity leave anyway and risk, not being economically risk economic issues in their families, or do they return to work knowing that they're not ready emotionally to continue working again? And then there's costs in terms of autopsies, burial costs, funerals. The cost of therapy is also a big thing. And so these are just some factors to consider that often are not talked about or addressed. There are some states that offer a tax credit for families, and this provides some, economic support for families who experience loss. And there are some organizations that provide financial support when a family has experienced a loss. And so right now we know that there are at least 4 states that have a tax credit. And then some other organizations provide emotional support, like the Believe Foundation, the Tears Foundation. And then for military families, there is SGLI, which is a benefit for military members if they've lost a child or a family member. So before 2001, stillborn babies were not granted birth certificates by any state due to a lack of legal language to do so. So through the Missing Angels Advocacy, families who had lost a child to stillbirth began receiving stillbirths stillbirth certificates. And then that sort of started a chain where now 43 states offer a certificate in birth resulting in stillbirth or a stillbirth certificate. So here you see in this picture, this is Dr. Joanne Cacciatore, and she's the founder of the Miss Foundation. And she also led the first bill that passed in Arizona. This is back in 2001, that finally allowed grieving parents to have the right to have a certificate of birth resulting in stillbirth. So this quote here is what Dr. Cacciatore mentioned when she explored, before there was a bill, she explored having a certificate for her child. And her daughter Cheyenne, and she was told, you didn't have a baby, you had a fetus, and that fetus died. And so if you can imagine as a parent, hearing how, your child's death is a death, and the birth of your child is not really recognized, can be devastating. So because of this experience, Joanne created the Miss Foundation, which currently advocates for parents who have experienced the loss of a child. And she is known as the originator of the Missing Angels Bill legislation. And through her advocacy and the work in her organization, it really has spearheaded others to step forward in their states to ensure that the birth certificate is something that is available for families. So why does a certificate of birth really matter? As a parent, you don't realize the significance of a birth certificate for your child who has died until you've been denied one. When a child dies, families and communities they experience tremendous grief, right? And unfortunately, many stillborn babies aren't given proper farewells. Many families and mothers don't have a chance to spend time with their child. In terms of how stillborns are cared for after the birth, is this huge disparities across the United States of what that looks like. And so the certificate of birth resulting in stillbirth really acts as a formal recognition of the baby's birth. And in many states, it looks similar to a birth certificate, and is issued when an unborn child passes after being in the womb at least 20 weeks. And so we'll talk a little bit more about each state, but it really is important because it brings comfort. It can bring comfort for families. It can bring a sense of recognition. And so currently 43 states listed here on this slide offer some type of formal recognition which is either a certificate of birth resulting in stillbirth, or it may be named something different. But these are considered missing angel states. So if you look closely, we see that Washington State is on this list. That's where I'm located. California, there's many states on this list that now offer a certificate, which is really promising, is very hopeful. And it's good to know that this is still available for many families. However, there are still states that do not offer a certificate for families. And for some, legislation was introduced at some point, but the legislation didn't pass or succeed to make it into law. And so here are some states right now that don't offer the certificates of stillbirth. And that includes Hawaii, Vermont, Kansas, Kentucky, Wyoming, and Rhode Island. So if you are from that state and you're here today, and you're wondering more about how do we make this be a possibility in our state, we'll talk about some pieces of advocacy that are important to move this forward. So I just wanted to point out some resources here. Star Legacy Foundation. When I lost my son Jackson in 2017, Star Legacy Foundation was one of the first organizations that I became involved in. And my husband and I did support groups through Star Legacy Foundation and really got a lot of support. And so they have a pretty comprehensive resource guide right now. If you click, these slides will be available to you later, but if you click on this link here, you will find a you will find a resource guide that has all the states listed in the United States that offer a certificate, and it has links to the Department of Health in that state, or how you can get to that state's webpage to find out more about how to apply for a certificate if you live in that particular state. Also, the resource guide has information about the cost associated with the certificate, with applying for a certificate. And it also has information about the tax credit. If there is a state that offers a tax credit, it's listed in that resource guide. So it's a really great way for families who are questioning or not sure to do a little research and find out what their state offers. Another resource I want to share with you all is from Star Legacy Foundation, is a Stillbirth scorecard. And this is an interactive map. So on this slide, it's not interactive. But if you were to go to the link on the slide, you can highlight over the state where you live, and it will tell you the rate of stillbirth in your particular state. It will also give you more information about, as you can see kind of the scorecard here, it'll tell you the rate, causes of death, maternal age, different statistics from a state standpoint. And so this is a great resource, again, to educate yourself, to be more familiar about how your state is handling or viewing stillbirth. So the first step, in terms of advocacy in this process for anyone, is to understand the current status. And so these are some resources to help you understand the current status in the United States as a whole, as well as within specific states. So I do recommend going to the resource guide that I mentioned earlier, and then checking out this scorecard to learn more. So when we think about those, the states that I mentioned earlier that are not offering a certificate of stillbirth, not too long ago, Washington State, where I live, is one of the states that did not recognize stillbirths. So here is a picture I'm sharing with you all of my family. And last October, we went to the state capitol in Olympia after our bill was passed and made into law, which was in April of 2021. We were one of the first parents to receive a birth certificate for our son, Jackson. And so it really has been through this experience that has shown me that sharing my story as a bereaved parent provides the essential insight that is needed to enable change to happen. It really is stepping forward and sharing my story. And I'll talk more about what that looked like specifically. But when it comes to, coming together, sharing our stories as parents of stillborn children, we are speaking what is often left unspoken. And so that in itself is advocacy. That in itself is revolutionary. And so we are breaking the silence around stillbirth and bringing attention to those who have institutional power to make change and really make a difference. And so I just wanted to share this because I realized the power of this through my own advocacy work when the bill was passed, and then we were able to get a certificate for our son. Okay. So when we think about advocacy, what comes to mind for you? I bring this up because like I mentioned, I'm a clinical social worker. Advocacy is a part of what I've been trained to do, taught to do, things like that. But advocacy at certain levels is something that is at the time was new to me. It's not something that I was involved in. And so I learned a lot about what advocacy actually is and what it entails. So if you can see yourself in this role as an advocate, anyone can really be an advocate. So we advocate in many ways in our daily lives, and we don't really recognize it. And so what is advocacy? Advocacy is a method. It's a process. It can be broken down into, many different ways to accomplish a goal and to move from point A to point B. It's a way to make our voices heard when there's an injustice. Either we experience it ourselves or people in our community that we care about experience it. Advocacy isn't just about talking, though. It's about taking action to create change. And it can be formal, informal activities that we do. Um, Advocacy really does mean speaking truth to power and seeking out ways to shape and influence decision making to bring about social justice and political outcomes. And then advocacy is also about educating the public about an issue. Um, and that's a part of the process too. So as I mentioned, anyone can be an advocate. You don't need special qualifications, right? You just need to care and have a passion for change. Speaking up and sharing your views about a topic or an issue that interests you is advocacy. Joining forces with those who can help you bring the issue forward is also critical to realizing the change you want to see. So this slide just talks about some steps in terms of becoming an advocate. Finding your community is one of the biggest pieces for me in my personal experience of what helped me move forward. So joining that group of bereaved parents was my community, but also being involved in RTZ Hope was a part of my community, and learning more about my experience and helping others see like they're not alone. This happened to me. I've experienced stillbirth. And so how can we come together to raise awareness and use our stories for advocacy? It's also important as an advocate to have an elevator pitch. I know that sounds kind of awkward, but it really is bringing your story to life in a way that others will want to listen. And so in the beginning of your loss, it may feel really hard to do that because we want to share so much of the hard stuff and the raw stuff. But really, the elevator pitch is the key points you want to get across to those that can make a difference in your story. And so it will take you really thinking about, how does stillbirth affect not just me, but the people in my community? What are those numbers, going back to looking at each state and their rate of stillbirth, and what's needed to bring about change. So very succinct information that you can share and how you are impacted by that. So policy, when we think of policy, the word itself can be really, I feel like, convoluted. And so when we break it down, policy is a set of ideas or a plan of what to do in a particular situation that has been either agreed upon to officially enact change by a group of people. It can be by an organization, a government entity, or a political party. And for many of us, either attending today, the thought of political advocacy is daunting. It can be really intimidating. I myself experienced feeling really intimidated by the idea of sharing my story with elected officials, with people who, represent my community, but I've never really had a conversation with them before. And so for me, even like as a social worker, as I mentioned, I didn't have a lot of experience or a roadmap of how to affect change at that level until I went through it myself. And a lot of times until you have paved the way and actually experience pushing legislation forward or reaching out to your legislators to share your story, until you've actually experienced that or been around people who have done that, you may feel lost. You may not know how to get started. How do I even start to use my story for change? And so I just wanted to share what I've learned And so here is kind of a roadmap. And I'll talk a little bit about each one in more detail in the next few slides, excuse me. So doing your research, I know sounds very simple, but really doing your research is making sure that you're well informed about the particular issue. So as a survivor of stillbirth, I was well informed through my lived experience, but I also had to learn and know the research beyond just my experience. And so that took me learning more, researching more about stillbirth. That also includes familiarizing yourself with the legislative process in your state. Checking out your state legislature website is a great way to start to see who's in my district, who represents where I come from, who should I be talking to, who are those elected officials. Before this experience, I had no clue. I was not really involved in political advocacy. And I learned a lot by going through this particular experience. So doing your research is important. Understanding how the problem affects your community and why should elected officials listen to your story? What's important, right? Another resource that helped me in terms of doing my research was finding bill tracking apps, so that I can stay current on if I'm watching a certain bill, like the bill in my state. I subscribe to govtracks.us, which is a tracking app that you can track bills that you want to know more about, or you're tracking, so that you can be more involved at the legislative level. And also just talking with other folks who care for the same issue that you care about. So how do you identify your state legislators? So first you want to find the website, like I mentioned earlier. You want to really spend some time on that website. For me, I had to find out who were the elected officials in my district. I didn't have language to put to that beforehand. And so being a part of those group of moms really helped me understand the significance of knowing who I should be talking to, who I should be approaching about my issue. And then once you locate those individuals, you want to know more about what their legislative priorities are. What are the things that are important to them? What are they fighting for in terms of, or what bills are they currently supporting? So that you know a little bit about them and their priorities. Also on that website, you can find out when a bill is going to be heard during the legislative session, how a bill will be heard, if they will be taking testimony, and if there's opportunities for you to make contact either by sending an email, or in our state of Washington, we have a hotline that you can call. And those are opportunities where you can send messages to those elected officials about, your concerns, things that you want to get across for them to know. Finding other champions is also a piece of this roadmap that's important. Doing this work, we don't live in silos, and passing the certificate of birth resulting in stillbirth in Washington State was a community effort. It was not a one-person effort. And so if you are passionate about a particular issue, finding others that are passionate with you is the first step, so that you can get support. So you won't do this alone. You could also benefit from having allies, people or organizations who want to support the cause as well. So I mentioned Star Legacy Foundation, RTZ Hope. There are others out there that are fighting and pushing for legislation around stillbirth prevention. And some other strategies that can be helpful too, to find out, well, who are the other champions? Who else is wanting to do this work? is by looking at who are the other stakeholders, what other communities are affected, and presenting to those communities with your story and telling them, how can you partner? How can we come together? Because I'm passionate about this issue. How can we come together to make change happen? And I'll show you an example of what I mean by that in a couple of slides from now. And then after you've identified your champions, your allies, you want to create a plan to carry out the advocacy effort that you want to do. Remember, advocacy, there's many types of advocacy. There's self-advocacy, there's group advocacy, formal and informal types. So you want to be thinking about, what is it that I want to get across? And how are my champions able to help me with that? So if it's scheduling a meeting with a legislator, that can be something you can start to plan around. How do I do that? How do I make contact? What is their contact information? Who do I need to talk to get on the calendar? If it's sending an email or making a phone call, who do I need to call? Is there a legislative aide that can help me reach my legislator so that I can spend time with them and ask for an appointment? If it's through social media, nowadays social media is a great avenue to raise awareness about an issue. And so you might want to plan around that. How can I do that in a way that's impactful, that's meaningful, that brings other voices to the table? And so this slide just talks about other examples too, like creating a video, which is a really creative way to share your story. Sending an invitation. Maybe you and an organization that you're a part of is doing a campaign or some type of awareness event. Maybe it's a walk, a walk to raise awareness around stillbirth. Maybe if you have that event, inviting your legislator to come and be a part of that event just to learn more about your community. So I mentioned earlier some examples. So this is just a letter from that our group put together to request some time with our Washington state legislators. And so if you haven't seen an example of a letter, this is just one. But really, the letter is strategic in that we have a specific ask, right? We're asking for time to speak with the legislator so that we can share our concerns and our stories. In this letter, we talk about some key points and statistics around stillbirth and how it impacts our families. We talk about disparities in terms of race disparities. We talk about mental health in this particular letter. And we bring out, how does stillbirth affect our state from an economic standpoint? And also, how does that affect, the whole society? In this letter, we also talk about some solutions that we want to see. How do we want to see change happen? And so it includes a call to action. And so when you send a letter, it really should have some key pieces to it, which are the things I just mentioned. A clear ask, specific points, statistics, information. Why is this important? Who does it impact? And then what do you specifically think should happen for change? And then what are you asking a legislator to do? Are you asking for an appointment with them? Are you asking them to support a bill? So here's an example of that. This second example is an email that I sent to a senator during our process of pushing the legislation around the certificate of birth in our state. And so as you can see in this letter, it's very targeted. It's targeted towards a particular senator. After I did some research to find out what this person was interested in, what type of issues mattered to them, and I wanted to get their support for passing the bill. And so I asked for some time. I asked for an appointment to meet with them, and then I shared a little bit about myself and my story in this letter. And as many people on this call may have realized if they've done something like this before, is that these attempts to connect with folks are not always accepted. So this was not the first. This had been like maybe the third letter because I had gotten no response. And so persistence is key. Keeping up with it, not shying away because the first ask is either ignored or there's a decline. You have to stick with it, and it's hard because it feels like all my efforts are on deaf ears. But because legislators have different priorities each year, a lot of times you're having to deal with making your case for why this is important now and why you need their support. So I would say if you learn anything else from this, is to stick with it and not give up. So this is another really good quote that keeps me going in terms of the importance of sharing a story. And this is from Maya Angelou, and she says, "There's no greater agony than burying an untold story inside of you." It's all about sharing your story and getting permission from others to share their stories. And one way that I've experienced doing that, not only through education, webinars, information, but also through testifying um, on the stillbirth bill in my state, through sharing my story and testimony. And the benefit is that, especially around COVID, what I saw, the benefit was that it can be done virtually. Um, and that creates greater access for people to to be able to share their story to a committee, excuse me, if it's offered on a virtual platform versus going in person, which can be far away. Okay, so I know we have about 10 minutes. I want to shift now to talking about the importance of taking care of ourselves as we fight for change at different levels, especially when the thing that we're fighting for it directly impacts us. So as a stillbirth survivor, it is through, like I mentioned, telling our stories over and over again to new people that can be really difficult to do. It can be emotionally taxing. And when your stories are not readily accepted by others, or others don't quite understand, and so they're not sure if they want to support you, it could be devastating, and it could be hard to keep going. But I think that it's imperative that we make a plan for how we're going to care for ourselves if we want to continue this work. So why is it important for advocates to practice self-care? It's because that there are perils of advocacy that occur that we don't talk about. And so as an advocate, you're at risk for burning out. You're at risk for overworking, feeling exhaustion. Sometimes you could lose your identity in the work, and it can take a toll on you and also people that care about you and your family. It could affect your relationships. And it's it can really bring up, especially if you have lived experience, it can bring up things that you maybe haven't dealt with, because you're sharing and exposing your story over and over again, which can be hard to do. So what are some strategies for caring for yourself if you are taking on the work of advocating for change at any level, at local level, at the policy level? So some strategies is one thing is to shift your mindset about it. And so how would you shift your mindset is by telling yourself that, change takes time, and focusing on those small wins, the things that you're able to accomplish in that finite amount of time, and telling yourself that that small change is still meaningful, and it is moving the needle forward, even if it's just for a little bit. It's also important to make sure that you're setting realistic goals for yourself. And these realistic goals are things that you want to accomplish and what's meaningful for you in the change that you're trying to make. It's also important to express your feelings when you are feeling like the change you're trying to push for is not happening as fast as you would like. It's also critical that if you are experiencing stress and exhaustion, to share that with others around you, to be in community with others who are sharing the same challenges, because again, it can be very taxing. And it's okay to really say, I need a break. I need to step away from doing the advocacy work right now. Maybe I can advocate in a different way. But recognizing what you need to care for yourself to move forward is really important. So I have a quote here from the Light Makers Manifesto. And this is a really great book about how, if you're pushing for change and you're an advocate, how it can be hard, but also how to not lose hope and how to not lose joy in the midst of pushing for change. And so I just wanted to highlight that here. Radical healing is another approach to self-care, especially for communities of color that have been marginalized and maybe experience, traumatic experiences more than others. And so radical healing is a psychological framework, and it includes different aspects. It includes collectivism, critical consciousness, this idea of radical hope, strength and resistance, and cultural authenticity and self-knowledge. And all of that means is self-care and radical healing is about bringing in our cultural aspects of who we are to practice restorative self-care. And so that can be engaging in community healing circles with others who share your story or have traumatic experiences similar to you. It could be engaging in advocacy work, storytelling from not only your story but from an intergenerational story. And again, it's about culturally specific practices that promote resilience and well-being. So how does that relate to stillbirth advocacy? You're probably wondering. So with stillbirth advocacy, as I mentioned earlier, this approach has various aspects that are linked not only to the medical issues or healthcare issues, but also there's layers of racial and ethnic disparities when it comes to stillbirth that we are still trying to deal with in our country. And so taking a radical healing approach recognizes the significance of those inequities that some groups experience when it comes to perinatal loss. I particularly like this model because it highlights that hope is a necessary factor in achieving progress that we want to see, and that it brings in that cultural piece and the resilience that is so important if you're doing advocacy work. So I just wanted to share that here. So if you're thinking about some organizations or resources of how to get started or who's doing some work around stillbirth awareness, here are some organizations to learn more about. Many of these organizations I've either been a part of personally or have learned more about through my research. So Return to Zero Hope, we all know, has a huge footing in terms of raising awareness and breaking the silence with stillbirth. The Believe Foundation is also doing this work, especially on the political aspect of bringing stillbirth to the forefront. Black Mamas Matter Alliance and Mamas Voices, these two organizations help folks who identify as African American or women of color who have experienced loss. It helps understand from that perspective those disparities, but also how to use your story to affect change. So as I come to a close here, I just want to dedicate this presentation to those bereaved parents, families, the policymakers, the legislators who we spoke to, who listened to our story, our sponsor, Clark Gasson with the Believe Foundation, our lobbyists who championed for the bill to pass in our state, and all the families in every state that have experienced the tragic loss of a baby. I just want to dedicate this presentation to you all. And for those who are continuing to fight for change and raise awareness around stillbirth. And I want to acknowledge the millions of babies born across the globe who we have not forgotten, we will not forget. So this last quote I want to end here is that death ends a life, but not our relationship, our love, or our hope. Thank you so much for attending today, again on a Saturday. Are there any questions? I also wanted to share how you can get in contact with me if you have questions about this presentation or would like to partner or connect in the future.
I hear a big audience clapping. That was incredible, Kima. Thank you, thank you, thank you.
Thank you for having me.
Beautiful presentation and so much good information for parents, for providers, for me, everybody. Yeah, thank you, thank you. And yeah, feel free to ask questions. We have a little bit of time. Yeah, thanks, Denise.
Thank you.
All right. Well, thank you everyone for being here. And Kima, you're amazing. Big hugs to you and to your family and for all that you do. I look forward to seeing you again and working with you again. Yeah. Thank you so much
Jennifer.
for doing this with us.
Thank
Yeah.
you. Thank you for the opportunity.
Yeah, absolutely. And everyone take care. Enjoy the rest of your Saturday. And this presentation will be online on our website pretty soon. Looking forward to that. All right. Bye, everyone. Thank you.